Welcome to the symposium. I want to give a special welcome to folks we have in an overflow room just across the hall from the room we're currently in, and to people on the web. We've got about well over 60 people on a webinar that are going to be streaming into this meeting. My name is Jeff Capobianco. I'm with the National Council for Behavioral Health, and I'll be helping facilitate the symposium today. Very excited to have you all here. Simply by the number of people that have registered and taking part in this really underscores the importance of what we're doing here today to really begin to tell a new story about how we can better meet the needs of families and children who are experiencing attention deficit hyperactivity disorder. Today we're going to have a very busy agenda, so we're going to ask that people hold their questions. We've got some very informative speakers. You might want to ask a question, and you certainly can. We just ask that you do it in the form of writing it on the web chat to the right of your screen, if you're on the web, or if you're here at the meeting with us, there are cards in your packet. You can write your questions on those cards, and there's also an evaluation where you can write your questions down. Certainly at the break times and in our afternoon breakout sessions, there will also be additional times for people to ask questions. Some housekeeping notes. If you're in the building, the bathrooms are just outside the lobby to the left or right. So if you go to the lobby, if you're coming from the overflow room, it'll be on your right. If you're coming from this room, it'll be on the left. We will be breaking at noon for lunch for 1 hour, and we will start promptly at 1 o'clock after lunch. If you have been here for parking, if you have parking, please make sure you validate those tickets with the reception area. There's a lot of material to cover here today, so make sure you look through your packet. Each of you are responsible for doing some of the work we're going to be doing today. This is actually a working meeting. So we ask that you take a look at the agenda, and you'll see that there's 3 themes that really play out today as we talk about this very important topic. And they are: how can we improve the assessment, how can we improve the treatment, and how can we improve the support to families and children who are experiencing these conditions. We would like each of you, because you have your own story, your own experience with this topic area, to think about how, in your experience and based on what you learned today from the topic speakers, how could this be improved? How could you be a part in the improvement? How do you see others being a part in the improvement? And in the afternoon during the breakout sessions, we're actually going to really dig into that topic area, looking at how we can improve things and identifying solutions to move forward. Other than that, I just want to again welcome everyone. Thank you for coming, and would like to introduce Secretary Kathy Kliebert from the Health and Hospitals of Louisiana, who's going to give a brief introduction.
I'm Kathy Kliebert, the Secretary of the Department of Health and Hospitals. I'm glad everyone is here today, and as was said, by the interest that we've had for this symposium, clearly this is a topic that we all have invested a lot in either in the past or recognize what it means for our future of our children in Louisiana. We know some of the stats, and y'all going to hear more about the stats today about both in Louisiana and nationally and what that means. But I appreciate everybody's attendance here. We've got a lot of leaders here today, champions from all different areas of medicine, behavioral health, health plan management, education, family members, advocates, and government. I hope the end goal today is to develop solutions to address the proper utilization of ADHD medication in Louisiana's children. First, I'd like to take a minute to thank both Senator David Heitmeyer and Representative Scott Simon. They both worked really hard on a resolution in the spring legislative session. I'd also like to thank our panelists and members of our ADHD task force that was developed. And I'd especially like to thank Dr. Kristen Savecki and Heather Taylor. Where's Heather? I see. Oh, in the back over there. They're the 2 people that worked so hard to pull all this together, to get all the logistics, to make sure we had good panelists, to make sure that we had, good space as well as good information that we'd be sharing today. So thank you both for all your hard work so far, and we still have more work to do. This past spring, the nation's largest prescription drug manager, Express Scripts, issued a report with some disturbing facts about the use of ADHD medications in Louisiana. Louisiana had the second highest proportion of residents on an ADHD medication in the country, at 4.7% for the population as a whole, and an alarming 13.6% for boys aged 12 to 18. Louisiana also has the highest number of older girls and young women on ADHD treatments. In 2012, 7.8% of girls aged 12 to 18 were on ADHD drugs, while 8% of 19 to 25-year-olds were taking these medications, nearly double the number of females their age undergoing similar medication treatment nationwide. So in response, the legislature passed Senate Concurrent Resolution 39, sponsored by Senator Heitmeyer, calling on our department, the Department of Health and Hospitals in Louisiana, to study how the state can ensure the proper utilization of ADHD medications in Louisiana. We quickly assembled an internal task force to study the issue with representatives from Medicaid, the Office of Behavioral Health, the Office of Citizens with Developmental Disabilities, and the Office of Public Health. This task force looked at state and local data, some of which you'll hear about today. And, you know, our data, as the Express Scripts data, showed some very troubling trends. So, for example, according to our own data, 14.2% of 5-year-olds on Medicaid in Louisiana born in the month of September are on ADHD medication. Only 6.1% of 5-year-olds born in October are on ADHD medication. So almost over double the amount, 2 different months. Does that mean that we have a lot more kids in September that have a clear diagnosis of ADHD? Of course not. It just means that those are the youngest kids in our classes. They're seen as developmentally immature, and so nearly twice as likely to be Medicaid. That's a really scary statistic when you think about it, because as I said, you know it's not the fact that somebody born in September is any more likely to have an ADHD diagnosis than somebody in any other month. So clearly there are some things that we have to look at in both the assessment and diagnosis and treatment of those children. Dr. Susan Visser from the CDC will also share with us the national data and possible solutions other states have implemented to ensure the proper treatment for children diagnosed with ADHD. We'll also hear from a panel of Louisiana experts on innovative efforts taking place in our own state to find solutions for our state's high rates of this ADHD medication utilization. Lastly, and most importantly, we want to hear from you. We'll have breakout sessions near the end of the day so we can gather your input and expertise. From our work today, we will develop a report to the state legislature outlining possible action that can be taken by our state to deal with this issue. We also want to be able to inform you so you can share with your friends and communities what they can do to make sure that ADHD medications are utilized correctly. Now, I'm going to go off my script and talk as a mom. You know, as a mom, none of us want our kids to be on medications at all. Certainly not an ADHD medication that we don't know we don't really know what long-term effects these medications are going to have on these kids 20, 30 years from now. I mean, these medications are fairly new. We have some research which is already disturbing in terms of long-term effects, but we certainly don't know what's going to happen in the future with long-term effects. But also as a mom, I want a child, when I raised my 3 kids, one of whom was extremely hyperactive, I wanted my child to be successful in school, to be successful in a career, to be able to have friends and be happy in her social life. However, kids with ADHD experience problems in all of those areas. So our goal today can't simply be that we want to reduce the number of kids on ADHD medication. Our goal has to be that we want viable alternatives for families, for parents, for providers, for pediatricians that are faced with these issues, our educators. We have to have viable alternatives for them because, again, I think what everybody wants is those kids to be successful. And certainly as a parent, we want alternatives, other options that we have. So I ask you today to be innovative. think of things that are alternatives to medications for these kids. Work with us to figure out what a truly good assessment and treatment process looks like. Help us, give us feedback on what options we need to have in the future in Louisiana for treatment and alternatives to just medication. So please, again, as was said earlier, this is really a working group. Please give us your feedback. Give us your thoughts. There's lots of inventive things going on throughout the state. One of my favorite things is what went on in Finland with kids in schools doing a 45-minute instruction time, 15 minutes free play every hour. Every single hour during the day. Wouldn't that be great if we could get some schools here that were willing to try that? So be innovative, be creative about things that we can do differently in this state to offer alternatives to those families. Thank you again for being here. Appreciate all of your time and attendance.